most of the therapies that are used today involve the chemical acetylcholine in the brain. Basically, they increase the chemical that is reduced in Alzheimer's disease. And by doing that, they reduce the progression of the disease over time. There's no cure, but there's no cure for a lot of medical problems. What you want to do is reduce the disability and morbidity over time so that by the time, for example, over a 10-year span, the patient is much better off having used the medicine than not, because the rate of progression is reduced. And there are new medications coming out every day. The most current one is called memantine, which works on a different receptor in the brain than the traditional therapies. And of course, there are behavioral therapies for depression and psychosis and violent behavior and such, which involve a multidisciplinary approach involving psychiatry, neuropsychology, and physical therapy. Therapeutically, there's now work on gene therapy, where you inject, for example, a gene into the cell that reverses the misprocessing of protein. And there are medications that, again, increase the concentration of chemicals that are reduced in the brain, such as acetylcholine. And there are medications being developed to reduce the rate of cell death in the brain. So in the next 20 to 30 years, we'll have much better understanding of how to diagnose it early so that, again, we can attack it early, and by doing that, reduce its progression. And also more medications coming out that work in different pathways to reduce the progression and death of cells.